let's look in more detail at the plans to scrap Plan B COVID restrictions in England announced yesterday by Mr Johnson. They've been welcomed by many, including hard-hit businesses, of course, desperate for a return to normal. But for others, whether it's hospitals fearful of increased pressure on already stretched services or those who are clinically vulnerable, the relaxation is a cause, of course, for anxiety. Well, joining me now is Jonny Bongo, owner of Bongo's Bingo, Dr Dan Goyal, an NHS medical consultant, Simon Walls, clinical lead at St Cecilia's nursing home, and Marina Gardiner, Legge, head teacher at Oxford High School. Very good to see you all. Thank you very much indeed for joining us, panel, if I may term you that. And I want to start with you in descending order, I suppose, of enthusiasm for the relaxation. So that means you're first, Mr Bongo, if I can call you that. You better explain to us, first of all, what Bongo's Bingo actually is. How's it different from regular bingo?
Bongo's Bingo is it's quite hard to explain, really. It's quintessentially bingo at its core, but it's also like a nightclub, a rave, crazy prizes, and a packed warehouse full of 1,000 people partying and playing the beautiful game of bingo. OK, so a packed warehouse full of partying people. No doubt you're pleased to see the restrictions eased. Then, particularly, you were checking COVID passes. So we were checking COVID passes in a number of the venues. We do our event in around 40 cities around the UK. The main thing for me is it's the customer confidence, and that's something that we've really seen just since January. You know, December was a really tough time. You know, it was a will we, won't we be able to put on our shows? And we noticed a lot of sold out shows. We were doing them to half capacity because people were apprehensive about coming out, especially around Christmas and the rates being really high. But now, certainly after New Year, our sales up until April, we're at 90%. They're flying out, and for me, that's a positive. It's people are really busting to get out, let loose, and almost try and put this kind of behind them.
All right, so it's as much about the signals, the messages it sends out as the formal regulations themselves. Marina Gardiner, Legge, tell us what you've done today at school. Have you dropped face masks? Because, of course, you're allowed to.
Yes, I have, Dermot, but I think the face mask is only one step. It would have been nice if we were told a little bit in advance. I think with any kind of change, and particularly when you're in a position of leadership, I'm not going to say any more. I think part of this is dealing with COVID in our communities is dealing with the requisite anxieties and concerns of different people. And the one thing I've learned as a head is there's always going to be somebody who disagrees with me. If I talk about face coverings in schools, there are always going to be people who write into me about children's mental health, just as there are going to be people who celebrate if I say you can. And I think the most important thing, and certainly the thing I've learned, is that rather than it being a government diktat, I think the most important thing for heads is to deal with their own contexts. I know so many colleagues of mine in different sectors and different parts of this country who are dealing with huge numbers of staff absence, with mental health issues, with students in year 13 and year 11 who have never taken public exams and their commensurate anxieties, and loads of students who are having to miss schools because of staff absence. And I believe fundamentally that the most important thing is to leave different business owners and different schools to be able to match their own communities. And I would really have welcomed a bit of notice so that I could go to the teacher who's living with her 90-year-old mother and say, I am going to relieve classrooms and I am going to say to pupils they don't have to wear face coverings. And I would have liked a bit of time to talk that over with her and reassure her.
That's interesting what you say about it being sprung upon you. You kind of knew it was coming, but not so imminently. Simon Walls, from the care home perspective, and surely we've learnt our lessons by now about protecting residents of care homes, if that is maintained, are you happy then to see, other parts of the world, Bongo's Bingo and the rest of it, partying on?
I think we have to accept at some point, Dermot, that the possibilities is that COVID's going to be with us for a long, long time. And at some point, we do have to come out of the lockdown and the things that we've had to put into place, the Plan B measures that were put in. I think it is, like the lady from the school said, it's been a really quick knee-jerk reaction to come out of it. I hope that they do go slow with other things and consider to pull out extremely slowly because of the strains and the pressures on the NHS and on ourselves in social care. We still need to protect the people that are within these walls. I believe face masks will be with us for quite some time, certainly from where we are, and I believe so probably in hospitals as well. We have to protect the most vulnerable, and the people here, sadly, are most vulnerable.
I think everyone nodding along with that, and not just on the panel, everyone listening and watching. Dr. Goyal, tell us from an NHS perspective, do you think that this is too far, too fast? What are you seeing in terms of these easing pressures, we're told? I mean, I know it's all relative. It is winter, and, of course, the NHS is always under pressure in winter. But, you know, are things calming down a bit from your perspective?
No. I mean, I think the decision's a bit of a disaster, really, from the healthcare perspective. I think it's entirely the wrong time. I think we can see very clearly that this is not based on data science, and it's certainly not based on healthcare provision in the UK, which is at a proper low at the moment. You know, this is the worst I've ever seen the healthcare provision in the UK. My colleagues up and down the country would echo that. I haven't spoken to a single colleague who said that we're coping or it's not the worst winter we've ever experienced. And, you know, the timing is terrible. A few more weeks, we probably could have got through it. You know, so I'm very, very disappointed. And I think the public need to ask themselves a very big question. How much do we want good access to healthcare or even decent access to healthcare? Because at the moment, we don't seem to be getting it. The record 12-hour waits in A&E, which we know increases mortality, a record on the waiting list, an hour to get an ambulance to someone who's had a stroke. I mean, I think it's borderline and a bit of it's just a bit ridiculous.
Dr. Goyal, I just want to ask you, stay with you and ask you a specific question because people will want to know. We are told that, of course, COVID cases are dropping. Are the pressures you described there primarily still being caused by COVID and things you have to do within hospital, COVID protocols and social distancing, I understand? And also this question we've seen now that it seems some people in hospital with COVID are not primarily being treated for COVID. They either acquired it when they were in hospital or were asymptomatic when they were admitted for something else.
Yes, I mean, the reason we're so overwhelmed is that 15% of the beds are taken up with COVID patients. And unfortunately, the UK saw fit not to increase healthcare capacity at the start of the pandemic. At the last count in September last year, we were 4% less bed capacity than we were before the pandemic began. Literally one of the only countries in the world not to invest in their national health service to the degree that was needed. And we bear in mind, Dermot, every time we've had to lock down, it's because the NHS has been full or reaching capacity. And yet still we haven't invested in it. So there's no surprise, 15% of our occupancy to COVID. The NHS England is 9% over safe occupancy limits at the moment. So
very
in terms
interesting
of the
to hear that. Yeah, I mean, fascinating to get that insight, Dr. Goyal. I want to talk about, well, money now, I suppose, with you, Jonny, Bongo. Does this have to be, this direction of travel now, does it have to be irreversible for you? Because you've been dealing with shutting, opening, half opening for, what, 18 months now?
Yeah, I think, you know, the nightlife industry for the last 2 years have suffered so it's been so tough. And, you know, 2022, we need a clear run, and, you know, we need to continue on just as normal. You know, we've been lucky that we've built up a business that's seen it through. But there's been so many people that haven't in the hospitality industry been able to survive. And, you know, we just need to move on, in my opinion.
Simon Waltz, I just want to go back to COVID infections because I saw you agreeing with Dr. Goyal there. Have you had any Omicron occurring in the home?
Sadly, we have, Dermot, and I know a lot of care homes across the country have also had a lockdown. We're still in lockdown at this minute in time due to an outbreak within the care home. So at this minute in time, we have 8 beds that are usually used for people that can relieve the pressure on the NHS. So obviously that's increasing the pressure on my NHS colleague to mean that they're actually having people in their beds that are actually medically fit for discharge, but they're unable to come into the nursing homes or the care homes because of lockdown because of Omicron. Now, it has been reduced to 14 days from 28, which was a positive in some ways. But also the different things like the swabbing on the 5th and 6th day, you can go back to work. There's still a 15 to 20% chance that you can still spread Omicron if you come back to work at that time. And in a small company, if you lose 2 or more staff, that puts you under even more pressure and then increases more pressure on the NHS and the risk again of another lockdown.
Marina, Gardiner, Legge, tell me this, and it's a version of the same question I put to Jonny Bongo there about direction of travel here in terms of what we were discussing earlier about the certainty that you need, that your staff need, that the parents need, and of course that the students need, and particularly this question about many of them sitting exams for the first time for 2 years. Do you need to know pretty much now that they are going to go ahead?
I think that's really hard, actually, for that to happen. But I think I'd like to pick up, if I may, Dermot, an earlier point. We talked about the NHS and we talked about its capacity. And we need, at some point, to talk about the epidemic of mental health issues that we are seeing in young people, the inability of the child and mental health services that are cracking at the seams. They are desperate to help, but they are under-resourced. Desperately under-resourced, and schools are dealing with the most incredible anxiety, not just in their young people, but also in their parents, and then again in the students. Now, we do what we can. We know that the most important thing for children's mental health is to be in school and to be with their peers. That's where their mental health issues and idea of self-esteem comes from. So we are doing our very best with that, but we also need this resource behind us. Otherwise, this generation are not just going to catch COVID, but they're also going to be scarred terribly and irrevocably if they don't get the support they need from specialists. I'm just going to go to Dr. Goyal on that because I saw you nodding along there. And of course, this is the issue with the whole of COVID-19. It's not just about the infections. It's all these unwanted byproducts in so many areas. And in particular, as Marina was just saying there, this issue of the mental health impact, the NHS is going to be dealing with that for years to come, one imagines.
Absolutely, Dermot. I mean, the mental health provision is shameful. I mean, we are hugely under-resourced, understaffed on the front line. But that, you know, what particularly the child mental health services have to deal with, you know, it pales into insignificance. It's so bad. And we should be ashamed as a nation that we've allowed it to slip that far. We deal with it every day. People are anxious. But Dermot, I think we come to the point where you're less anxious if you have good leadership. And if you are showing people that we're in control, we will escalate restrictions and protections when there's a surge of infections. We will release them when there's not. We will put mitigations in schools. We'll put ventilation systems in venues. You take control of the situation and demonstrate to the people. But I'm sorry, a flailing about leadership that really can't get a handle on it is going to increase everybody's anxieties. COVID is here. We have to face it. And I think, you know, we do have to protect the people.
Well, you're clearly showing great leadership in your own fields. Dr. Goyal, Jonny Bongo, Simon Waltz, Marina, Gardiner, Legge. Thank you all very, very much indeed. I'm afraid we're out of time. And when this is finally all behind us, I think we all need a good night out at Bongo's Bingo, don't you? Jonny, I'm sure you'll be keen to accommodate us. Yeah. See you all there.